So these sessions are following each other, and thank you for remaining with us today. You did well because it's a session like no other. If you looked at the program, I'm the only one who's in charge of directing, but to interrogate participants around this table, but to undergo interrogation as a director of Europol, it's kind of a challenge. So thank you for being present. We're going to tackle topics that are major, that have been tackled in certain other roundtables at the heart of innovation, with the treatment of health data with panelists, which will have different approaches and perspective, and which I think, nevertheless, although being very different, are going to converge. So you're an expert on. Are you going to start with taking up the challenge of making sexy interoperability? So we mentioned it since this morning. It's a topic with the team of La Poste Santé, Autonomie, Health and Autonomy have work on this. I would like you to get us back on a track where we're not very much aware of, the one that's been taken up in the United States on these issues. Contrary to what we might think, it's rather a centralized environment, very regulated, and which manages to achieve its challenges of interoperability. So, very well, indeed. I think the first thing on interoperability, why do we talk about that? Why is it important? We're all here today because we're interested in improving health. When we talk about improving health, it's something very broad. We talk about quality and relevance, accessibility, and cost. And these are three areas that can be very theoretical, but also very concrete, and they can be measured. And to be able to measure them, we need data. And these data, when they are defined in a different way, or in different places, or in different organizations, by different players, we can absolutely not measure efficiently the quality and the relevance and access and the cost. And so this observation was made a long time ago, and the path of interoperability has started in the US in 2009 with a small group of researchers at Harvard, which have developed technological open source technologies in the university realm, and to be able to access data, and which have really encouraged the adoption of existing standards. So when we talk about standards, not just about reinventing them, they exist. So the first step was the development of technology to access data, the encouragement of adoption of standards, with an evolution that brought that today in the US, any patient on their phone can have access in the US to all their health data, what care was received in a lab, hospital, doctor, all on their phones. Interoperability in the US is already a reality. So FHIR standards, which were imposed by federal legislation. That's the issue. Yes, what happened is that once this technological solution were developed, knowing that the standards exist, the whole development at the legal level, so the 20% React in 2007, it was mandatory to give access to health data without specific obstacle. So it's just a little mention in the law that was pushed by academics who wanted to improve the health of populations. So that was passed into legislation, and it was imposed very concretely until 2022, where the last mechanisms were adopted concretely. So that there are open source KPIs, so smart and FHIR and bulk FHIR, which are imposed by law, which allow all players in the health to have access to all innovators. All the companies can use are based on these systems to be able to have access to data on their side of production. It doesn't move around. It's like restored or transformed. It's kind of different to what we try to do to transport data in different packaging or warehouses. It stays where it is, and it's transported along the patient's path. Exactly. So for patient, access is done to data wherever the data is. If we have specific research project, for specific reasons, you might have data regrouped in certain places, but it's completely possible to have data stayed remaining on their production site and access to data that allow to have access to data you need for the question you have. One of the concerns with the sorting out and movement of data, when you pick, you eliminate. When you want to do AI and have an overview on all the patient's path, wherever he is, hospital, in the city or in the lab, you need to be very exhaustive. You need a structured and unstructured data. Before getting to AI, let's remain on this point. The initial matter. So this data it's going to be worked out to measure the difference with Europe. There's a harmonized version in Europe. So the Euro-American. So Trump is not putting into question this framework. And the difference with Europe is that objectives of interoperability are not very short-term. It's several years. Yes. So here, a major evolution is very important at the European level with EHES, so standards. So yes, since March 2025, there's a roadmap. There's a timeline that was planned that plans for the adoption of standards by 10 years. What is the problem we have? It's very long term compared to the evolution of the use of data for health, research, and public policy. So we need to go faster in this. Another issue is that the definition of standards is very good to use the fact that there's this movement towards FHIR, very good, but to be able to use API and open source, we need complementary specifications to ensure that all variables are defined by all producers of data exactly in the same way. So data that's defined differently in different places cannot be used. I'm going to turn towards you, my general. Data is a strategic challenge to manage security issues, and how did it make its way to Europol on this path of interoperability? Is it faster or slower? And why is it useful for Europol to be able to use this data? Thank you. Maybe you should wonder, what am I doing here? I wondered myself, we didn't allow ourselves to question that, and I wondered, yes. It's a real issue. The world in which we live is a digital world, and so you have all the idea of police investigation. We will go on these premises, and we do all sorts of yesterday. But on top of this, you have to add digital inquiry, investigation, and the data is at the heart, at the core of our investigation, specifically transnational inquiry that we support at Europol. And what type of data we're talking about? You can talk about all sorts of data on the occasion of an inquiry, whether it's a cyber attack. I'll get back maybe to it later. I don't announce good news here. You understood? I'm going to tell you that in data. Yeah, you're happy that you're here. There's also danger. And it's also that I just said. That's what I've come here to say. If we have an investigator about cyber attack, we're going to look into what data, what data was, what do we have to pursue the investigation. It's also for criminals, whether it's cyber criminals. All our life is on our cell phones, our bank accounts, and to track a path up until a proof that today is a digital proof in many cases, we have to explore this data. Does the European framework allow you to act? Is it interoperable? Do you have leeway to carry out your investigation? Not enough. And this is what we try to defend. At the same time, we are aware that we hold a power to investigate, which is superior to the power of just anyone. And so it has to be framed and constrained by judicial authorities and laws. It frames us, and sometimes in terms of data, this is what we blame Europe for regularly, is that it started to work on these topics. We'll get back on AI, by setting limits and boundaries. And where the evil is, seeing and not looking not to like boosting innovation, but to say basically careful, there are dangers or risks or hazards, so let's set up barriers. There's many of them today, interoperability that's mentioned, it doesn't exist. And we have the image, is it the same? If you look on the other side of the pond, the Bailey in terms of inquiry, is it broader for your colleagues to have better access to data in terms of investigation? Yeah, they have their constraints, their legal constraints. Also, it's not free for all. The U.S. is also there's a rule of law, a little less these days, but it's still the rule of law. They have many advantages. One of the major advantages they have is that all those who manipulate data at a big scale, I was hearing our American guest, such as Amazon, they're all Americans. They're all Americans. So they're sensitive to American laws. So when our colleagues from the FBI or DA requires data from them, they're much more sensitive than when it's us Europeans who tell them we need access to data. So of course, when we have that's under investigation, they open the door. But this is the same goal we have. We cooperate with our American partners on a certain number of topics. They have easy access compared to us that we don't have. And they hold, and this is a real issue of sovereignty that we need to tackle. For health data, as for any sort of data, cloud, major companies in the tech sector, we have a lot of paths to cover if we want to keep control over what we want to do. So it's a sovereignty issue. So what's interesting, by preparing with you, it's an observation that struck me, that I didn't understand right away, is that we have an environment of interoperability, that environment that's very regulated, very standardized in the US, and on the other hand, you mentioned AI, maybe we can get to that now, it's the reverse. Europe has adopted its European regulation on AI. It's an homogeneous framework that established the human guarantee element that we mentioned at SHAM several years ago. And on the other hand, Trump got rid of the Biden Act on the AI regulation, and he's in line with the big tech companies. And now he says this 27 states have recreated their own AI regulations, so it's becoming more and more complicated to apply systems there. So Maryaline, it happens that in a way that we have an ideal environment to get more interoperability in the US, but without using AI. And in Europe, we don't have a sufficient framework for interoperability, but a good one for AI. So what can we do? It's an observation that seems fair. We see that in the US, we have more and more use of generative AI based on the richness, the wealth of data that we can really have access to. So this allows on prevention that we mentioned earlier, on chronic disease, all the complex issues, health issues, to really transform the health of population's health. In Europe, we see huge investments in AI today in a context of budget constraints and cuts, and we see projects funded by the European Commission that set up AI algorithms that are very sophisticated with researchers that are very good and strong in their field of AI, but use data that are absolutely not ready or appropriate to be able to be used in AI algorithms. And so that, as a methodologist expert on this kind of scientific project, when people ask me what kind of recommendation for public policy should be given for this kind of studies, I would say none. If you have data that is not ready to be used for AI, that have different definitions, that means different things in different countries or in different organizations, and you use AI software, you might have conclusions that are useless. And so we have a framework that's not appropriate. That is appropriate to use AI. We should move forward on that, but we should get back to a basic level, which is the definition and adoption of standards common definition of data and the prohibition of use of portability, and so the bylaws that they have and the regulation that they have in the US. So on the issue of data-driven, on the general framework for regulation, it's applied, should apply, by general, to security, except for defense, maybe, but the AI Act should apply to your activities. So regarding the AI Act, we're on the same level between health data and data on investigation to be considered in the high-risk level. The AI Act is based on analysis of a risk analysis, either of things that we should never see, such as adoption, social adoption, like facial recognition in public space, like in China. And then we have AI, high risk, low, middle risk, mild risk, and low risk. And so health data is in the high risk, which imposes us to completely document AI, the AI that we're going to use, to have them run on witness data to detect bias, facial recognition, or no tools that to detect. Tools can be multiplied indefinitely according to the use. We made tools of machine learning according to the needs. I took an example. We're going to have a server. We're going to seize a server used by cyber criminals. We're going to have to analyze this data that they hold. All the cyber criminality teams don't sort out their data in the same way, so we have to look at the structure, and we fabricate an AI tool tailor-made to work on this data. And since it's high risk, we're submitted to a complex process. We have to submit our tools first to European controller for protection of personal data. It's going to validate this before we can actually use the data. And we're still human-centric, so any work on AI is then revalidated by human and guaranteed by human. So it imposes us constraints, strong constraints that sometimes, how can I say it, make us a little use of the advantage of AI, because with AI we can go fast to get results. And since we have a whole process, a long validation process, in the end, we kind of take a step back. So in the works that we do, it's necessary to have a strict framework. We cannot send people to court with the things that are not validated and tools that are biased, etc. I think that there's a good balance to find between an efficient tool that we can implement quickly and the fact of being able to test it. And here your questions of interoperability are obviously important to us. The more we can test on broad samples, the more we're able to spot the eventual biases of the tools and to correct them. So we talk about deposits, data deposits, cybercriminality. Do you have a vision at the European scale of what it represents, cybercriminality on health data? With evidently seen from France many hot-button issues. What is the reality of the phenomenon at the European level? So to answer the questions that was asked, so the deposits to be exploited, question mark, for cybercriminals, there's no question mark. Then they've given their answer. They're going to exploit data, health data. I can tell you right away. And they did it already. How do we know that? We know it because there's not a lot of data, of figures. I have one figure for IBM Security in 2023. In the world, there are 42 million medical files which were exposed and used by cybercriminals. So it's massive. And health data, according to what I've heard in 2025, they double every 2 years. It's massive. After, we have elements through the work that we do. In 2024, we arrested certain cyber criminals. We put our hands on their infrastructure, servers, etc. So of a ransom software called Logbite. So the business model was to supply tools to practice ransoming. So again, to 20-30% of the amount of the ransom. So we managed to seize these servers, and what we saw is that we saw data that were stolen at the NHS in the UK, in French hospital that were attacked, etc. So the health data is it's covered by cyber criminals, which don't target necessarily. They're just going to sweep wherever the protection is the weakest. They're going to attack where it's weakest. So if you leave the keys on the door, or the door open, they're going to enter. You see, whether it's a hospital or anything else, it's not the issue. And then they seize the data that's of interest is nominative data, emails, phone numbers, tomorrow, DNA, tomorrow, with coding. So I think that there's a real risk. And I give something else. It's not well known, I think. With the Dutch police and Europol, we set up a website called nomoreransom.org, in which we make available 160 tools to decipher data, to encrypt data that was encrypted by cyber criminals. So we fabricate the tools at each investigation to decrypt the data. The principal encrypts the data, and then he asks a ransom to be able to decrypt, to break them. So we have a certain number of tools on the website, so nomoreransom.org. The message has gone through, and so for all the cyber criminals who will listen to us right now, they didn't attack the website yet. So that's the dark side aspect of the deposit of the source. There's a more bright side. Once it's interoperable, this data to develop AI systems, create continuity. What's the end point here? It's a potential that's huge, both for care and health professionals, for research, industrials who develop new drugs, medication, who do research on database, and public policy. And so in terms of deposits, we have the impression that it's a deposit, but for it to be useful, the data have to be ready to use. What we see is that often, in my former job, in the past 5 years, I was coordinating international research projects that used data of real-life data. And the clients, the industrials and pharmaceuticals, wanted to be able to carry out international projects using Canadian, US, French data. One of the obstacles that we had with French European data was often lack of standardization and long term for access. So the deposit was limited by this aspect. But right now, we're at a major turning point. Looking at the context in the US and what's happening in the research level, the FDA or CDC, or all the American research systems, companies, we have to stop on this. We mentioned the ability to use AI here. We thought the FDA system was stable and well established, and Unicode was in front of me at the health authority. I said there's something happening on the FDA side that can be of concern to the independence of the entity and the model of support for innovation completely. That's a real issue. So US was at the cutting edge of innovation. The state intervenes into the decisions of the FDA. I'm not going to comment on that, but what I think is that the current context gives us a context that are good for development of research in Europe that we've never had before. Companies and industrials turn to France and Europe. Before, it was the FDA first. It was a very robust innovation system, very performant and efficient. Today, it's a system that's being destroyed, well impacted or weakened at the minimum, and we see this research that's going to be turned towards Europe, and a deposit, yes, it really becomes a deposit under condition that we're able in France and Europe to accelerate processes. Procedures are too long and constraining, so standards, HL said, to apply, should apply them faster than in 10 years. Yes, applying the standards, simplify access to data. We see projects where in the US, Japan, they can have access to data in 3 months. In France, it can take a year or 2. So obviously, companies that want to carry out the project in 1 year, it's not possible. So simplify contractualization process to access data, adopt standards and favor interoperability, and finally regulate for what needs to be regulated, such as the fact to prohibit use of information, and those who supply data cannot block the change of a system from a system to another. It's part of the problem that in the US allowed them to free themselves from that. I'm going to turn towards you, my general. We discussed that before you arrived at some in the previous years. What Maryaline is saying right now, I can transcribe this. So the regulation and framework of regulation is as much important as the readability and accessibility. On one point, we interoperate, we open, is there, and maybe the risk that is there a real tension or alternative between opening and protecting yourself? Are there ways of opening up while protecting yourself? I think, yeah, there's ways to open and protecting yourself at the same time. We're all the same. We enter into a digital world. In a world we're not completely used to and accustomed to. Justice system is not evolved accordingly. There's ways to do it, but there's a lot of unknown, false images projected for some who have interests. So there's a lot of ignorance, and also something that are scary, and they think they should open everything or completely close off. I think there's a path to find. We have to work on these issues. I think it's fundamental. You have to work on them. You have to put them in front of to the public, politically also. There's not a good knowledge or refinement of all this at the level of political deciders. There are people who work on images and prejudice. There's great work to be done. There's a path, and you're laying the path forward, and we have to work on the issue. So we have to chart the path. We shouldn't leave this subject just to in charge of cybersecurity. It's a manager's issue. It's a decider's issue. It's this issue of cyber and data and AI. These are issues for managers and deciders. We shouldn't give that solely into the hands of technicians only. And just to bounce back to this point, interoperability, free, centered on patients and secure, much more secure than what was done before, is already available. So really, when it's free, it's free. So it's imposed on the US by legislation. It's being adopted in the UK, Israel, and Taiwan. This application, Smart on Fire and Bulk Fire, which are adopted, which are API implemented, allow to improve security and interoperability. So what I hope is that we're not going to take the next 15 years to reinvent that in Europe. Thank you. These guys are on fire. These guys are on fire.